Next one here is from Julio, who says, how should I make the decision to take 1 or 2 pills of any particular supplement when the instruction is once or twice per day or 2 to 3 times per day? That's a great practical point. The good news is when it says once or twice per day, it means that either one is okay. I generally tend to start low and then move up after a few weeks. Generally, I like to move things slowly in biological systems. Biological systems were not meant to function in square waves. Go from 0 to infinity and from infinity to 0. So be careful, but just, go up slowly. And then you've got to follow your own situation. Anne, what do you recommend to Julio?
Everybody's a little bit different. I have patients who tell me, look, I can take eight supplements, in which case we really work hard to try and figure out which are the most important, and we'll tend to give them 1 instead of 2.
Yeah.
It depends on the size of the person to some degree. I have a patient who she takes 120 supplements a day and has for many, many years. I can't convince her otherwise. She's an 82-year-old, very healthy, very active person who just got some kind of appointment from President Biden. So, what can you say? So everybody's different. I would say I work hard to kind of tailor it to the individual. Some people, if they take too many supplements, they get an upset stomach, etc. I generally recommend people take their supplements with food, because it's a supplement to their diet. But some things are best. There are a few things that are best on an empty stomach. So, you have to work with people where they are and individualize.
Yeah. Yeah, it's a really good point. And I think you have to remember, why are we using supplements? There's been a lot of pushback from the mainstream medicine saying, there have been claimed that supplements are a cure for Alzheimer's, and that's ridiculous. Of course it's ridiculous. We're not saying that it's a cure. What we're saying is, if you're going to get an optimal synaptic biochemistry, then you're going to have to deal with these various biochemical pieces. You do have to have the optimal magnesium, and you do have to have the optimal vitamin D, and you do have to have enough choline to make acetylcholine. So we're dealing with all these things that are abnormal in people who have cognitive decline. This is ultimately, as we've talked about before, a network insufficiency. So we're fixing that network and trying to get optimal ranges. At some point, as we learn more and more and more, as the research gets better and better and better, we'll be able to say, you just need like these 3, because these are the ones that are absolutely critical. The problem is, this has been a problem with cognitive decline that has been untreatable, no hope. And even the most expensive drugs, all they do is slow the decline a tiny bit. They don't make you better. And they come with horrendous side effects that unfortunately sometimes include death. So we want to do everything possible to get the best outcomes. And we don't yet always know what's going to be number 1, number 2. We do the best we can to say, you look like it's more resolvins are going to be your issue because it's inflammation. That's why we have the subtypes, for example. So again, you have to kind of look at your own response, your own outcome. And as Anne said, deal with what you're able to take. What you address. I have a whole set I take myself based on what I know needs to be changed, and I've adjusted it over the years based on problems I've had. So I think, getting your own feedback is very, very helpful, and working with your practitioner.